During this section, we're going to discuss Bezlotoxumab, which is a fully humanized monoclonal antibody designed to be given in addition to a standard of care antibiotic to reduce rates of recurrence of C. difficile. This one-time infusion achieved FDA approval in 2017. It achieved FDA approval based upon two studies, the Modify 1 and Modify 2 study. Within those studies, there were multiple groups. Specifically, within Modify 1, there was a placebo group, there was a Bezlotoxumab group, which is the fully humanized monoclonal antibody to toxin B, Actuximab group, which is a fully humanized monoclonal antibody to toxin A, and a combination of Actuximab and Bezlotoxumab group. The Actuximab did not successfully treat or reduce rates of recurrence of C. difficile, so it won't be discussed further here. However, within these trials, we see that the placebo group, the group that received a placebo in addition to metronidazole or vancomycin or fidaxomicin, had recurrence rates of 27.6% versus 17.4% with the Bezlotoxumab. Within the Modify 2 trial, which had a similar design, removing the Actuximab alone group, we see once again a statistically significant difference between placebo, which had a 25.7% recurrence rate, versus Bezlotoxumab, which had a 15.7% recurrence rate. So this one-time infusion that has a half-life of 19 days can be given in addition to a standard of care antimicrobial and effectively reduce recurrence rates with a number needed to treat of 10 overall. And in subgroup analysis, a number needed to treat in a cohort over 65, a large portion of the patients that we treat with C. difficile, of 6 to reduce 1 recurrence. How do I use this in my practice? I consider patients that have 3 or more risk factors for recurrence, and I will give this one-time infusion. The infusion is designed to be given at the same time as the antimicrobial course. And within Modify 1 and Modify 2, 94% of the patients that received this within 6 days of the initiation of the antibiotic. So this is just one other tool that we can use to prevent recurrence of C. difficile, or at least minimize recurrence of C. difficile infection in those at greatest risk.